These findings are governed by vital organs and often reveal even the slightest deviation from the normal body function. The changes in the condition of the client, improvement or regression may be detected by the observation of vital signs. So vital signs, why they are known as the vital signs? Because it tends to be normal in a healthy individual. When there is any deviation from the normal body function, this indicates that something is wrong, something is wrong in our body. So what are vital signs? They are body temperature, pulse, respiration, and blood pressure. So what are the purposes of vital signs? To assess the normal functioning of vital organs. So what are vital organs? Plus, what are vital
Heart
organs? Heart,
and heart, brain,
uh, and
liver,
liver,
kidney,
kidney. These are all the vital organs. So what is the purpose of us measuring vital signs? To assess the normal functioning of vital organs, identify specific life-threatening condition and plan the needed nursing interventions. Okay, to detect any changes in a client health status, or to assess the condition and progress met by the patient. These are understandable and self-explanatory. So coming to the normal vital signs. So normal body temperature is, you all know, it is 98.6 degree Fahrenheit, or in centigrade, it is 37 degrees centigrade. And the normal pulse rate is 60 to 100 beats per minute. And the normal respiration is 16 to 20 breaths per minute. And the normal blood pressure is 120 by 80 mm of Hg. Till here, it's fine, all right, right? So moving on to the next. So what are the types of temperature? So there are two types of temperature, okay? Core temperature and surface temperature. So core temperature, it is the temperature of deep tissue of the body. Example, your cranium, thorax, abdominal cavity, pelvic cavity. It is 37 degree Fahrenheit and it is remain constant. Okay, so how many types of temperature? Core temperature and surface temperature. So core temperature are the temperature of your deep tissues. Example, your cranium, thorax, abdominal cavity, pelvic cavity. And the temperature is 37 degree Fahrenheit and it remains constant. And again, coming to the surface temperature. What is surface temperature? It is the temperature of the skin, subcutaneous tissue, and fat. It can vary according to the environmental changes. The temperature, when you feel cold or you feel warmed or you feel hot or moist when you touch your skin, right? So that is known as a surface temperature. Am I all right? Okay, coming to the regulations of body temperature. So regulation of body temperature, meaning how does the body maintain its temperature? Balance of the body temperature is physiological mechanism, is a physiological mechanism and is physiological and behavioral phenomena. Okay, the neural control. So where is hypothalamus located? Anybody? Hypothalamus. Where is hypothalamus located? Anybody? Are you all sleeping or you are doing your own work, just keeping on mute, agreeing you are listening and but you don't? Hypothalamus is located in the brain. Okay, hypothalamus in the brain, they control body temperature. When they ask you, remember hypothalamus, okay, it might comes in your exam also. Hypothalamus in the brain controls body temperature. I might ask you, body temperature is controlled by, and then I might ask you, okay, in your exam, so remember this point, hypothalamus controls your body temperature. When the body temperature deviates from normal, hypothalamus activate heat loss and heat production, and impulses from hypothalamus are sent to the periphery, which cause vasodilation and vasoconstriction, muscle shivering, and piloerection. Okay, when this hypothalamus, they are the one who controls the body temperature. When you have high temperature, or when you have fever, or when you have hypothermia, this hypothalamus, it activates the heat loss and heat production. When you have fever, it will activate heat loss. When you have hypothermia, that is low grade, when your body temperature is very low, it will activate heat production. Okay, so they are going to send impulses to the periphery. Periphery are those your blood vessels. Okay, they are going to this hypothalamus are going to send impulse to your periphery, and they will cause vasodilation and vasoconstriction in order to compensate with the heat loss and heat production. So what is vasodilation and what is vasoconstriction? Anybody? By the word itself, vaso is blood vessel, dilation is dilation, and vaso is blood vessel, constriction is it's narrowing, constricting. Okay, so how they do muscle shivering? These are example of compensation: muscle shivering and piloerection. What is piloerection? When you feel cold, did you feel goosebump, or you don't feel anything? What happened when there is too much of wind, or when you feel a little cold? What do you feel? Don't you see your goosebump? Your small hair in your arms, in your bodies, they got erected, right? That is known as the
Yes, ma'am.
yeah, this is the compensation. So your hypothalamus is trying to activate heat production. So that is why you are having this piloerection, erection of your hair. That is your goosebump. Okay. So this is a neural control. So hypothalamus, remember this, it might come in your exam. So the first one is neural, okay, neural, and the second one is thermogenesis. The body temperature is being controlled by, first is neural control, second thermogenesis, thermolysis. Okay, so let's see this thermolysis. What do you mean by thermolysis? It means regulation of temperature by heat loss. The heat in the body is lost by radiation, conduction, evaporation, and convection. Okay, suppose in a hot summer day, you feel so hot, then what this hypothalamus do? Hypothalamus will activate this heat loss, body loss, by, there are four mechanisms. Okay, by radiation, by conduction, by evaporation, and by convection. So let's see what is radiation. Okay, so I'll tell you, I can give you one example. When you feel so hot, your palms are sweaty, right? So when some of your friends touch your arm or your palm, they said it's very cool. Your skin is very cold. Don't you find them saying any time? This is, your hypothalamus is regulating this heat loss, because your body is warm so much, your body is heating so much, so they are trying to lose this body heat. Okay, so the first one is radiation. What are the four types of heat loss by thermolysis? Everybody, are you all sleeping, or what are you doing?
Radiation, conduction,
Hmm?
evaporation, and convection.
On convection. So which organ is responsible for regulation of body temperature?
Hypothalamus.
Hypothalamus is located in
Brain.
Brain, ma'am.
okay. So let's see radiation. Okay, heat radiates from skin to the nearby object. The amount lost from the skin varies according to dilation of blood vessels when the body is overheated, and by vasoconstriction when the body is chill. Radiant heat loss can be enhanced by removing clothing and by body positioning. Example, person with extended arms and legs radiate more heat. So what is radiation? Radiation is a transfer of heat from your skin to the nearby object. So I can still give you one example on this. So when you feel so hot, you tend to touch some ice, or you tend to take out a bottle from your fridge. So you are radiating your body heat to the ice bottle. Did you get my point? So
Yes,
this
ma'am.
mechanism is known as a radiation. Even then, I feel so warmed. My body is producing so much of heat. So, but what happened? I can even sometimes when we have a friend who tends to be very cold, most of the time we used to touch their hand, right? So this is also kind of example of radiation. You are radiating your heat from the skin to the nearby objects. Are you understanding?
Yes, ma'am.
Yes,
So
ma'am.
the example, we can give example by person with extended arm. When you feel so hot, you tends to extend your arms and leg. So that the heat, they radiate more. Don't you feel? As soon as you reach home, you throw your bag and then you open up your dress and then you lie flat on your bed, spreading your arms, your legs. Am I wrong? So this is known as a radiation. Okay, you are radiating by the name itself. You are radiating your heat to a nearby object. Okay. The second one is. So now for the latecomers, we have already gone so far. We are talking about vital signs. Okay, the latecomers. So what are vital signs, latecomers? So vital signs, latecomers, any latecomers? What are vital signs? I don't know why everybody don't want to answer at all. Anyway, let's move on to the next. Okay, the next is conduction. It is the heat loss by contact of skin with environmental objects like air, water. Water conducts more heat than the air does. Example, the client exposed to waters at 32 degrees centigrade will lose. So when you feel so hot, you try to expose your skin to with some objects, maybe like air, waters, and cloth. Suppose when you feel so warm and so hot, you take bath with cold water. So this is how you transfer your body heat. So this is known as the conduction. Okay. Environmental objects like air, waters, and cloth. You are transferring your heat like in the environmental objects like air, waters, and cloth. So this is known as a conduction. And the next is convection. It is the method of transfer of heat by circulating air or liquid. Normally, convecting heat loss is minimal but can be artificially enhanced by the use of fans or hypothalamic blankets. So convection is also another method of transferring of heat by the circulating air or by liquid. Okay, by the name itself, by suppose you use fan when you feel very hot and warm, and then even you can use some wet blanket. So this is how you try to manage your body heat. So this is known as a convection. And evaporation. Evaporation is the heat energy is needed. In this evaporation, heat energy is needed to change water from liquid state to the gas state. For example, sweating controls body temperature through evaporative heat loss. Okay, so evaporation, suppose sweating is an example of evaporation. Did you get my point? When you have too much of heat, you will sweat. You will sweat so much. After sweating, your body will become a little cold. So this is an example of evaporation. So the sweating is a example of evaporation. Okay. Some amount of heat loss also take place in through lungs, kidney, even in bowels. Not only your skin is sweating, even your lungs, kidneys, and bowels, they also lose some heat through this evaporation. And then behavioral control. Behavioral regulation involves the voluntary acts that a person takes to maintain comfortable positions, a comfortable body temperature. Hormones alter their behavior when exposed to extreme temperature. Example, changes in clothing, increasing muscular activity, sitting with arms folded, taking cold showers and bed, etc. So what do you mean by behavioral control? So let's leave about control. So what do you mean by behavior? Behavior is your action, right? Your own action, what you are
Yes,
doing.
ma'am.
So suppose you feel very hot, you feel very hot. So what are you going to do? You can take cold bath, cold shower, or you can change your clothing from to a cotton cloth, or you can just sit very calm and quiet. So with your action, your own action, you are trying to reduce your body temperature. So this is known as the behavioral control. Okay. In thermolysis, what are the types of heat radiation, heat loss mechanism? Tell me. Just now I explained to you. Tell me.
Ma'am, radiation,
Radiation, conduction,
conduction, evaporation, and
evaporation,
convection.
and
Okay, give me one example of evaporation. How the body try
Ma'am,
to
sweating.
evaporate. Sweating example.
Ma'am,
Okay,
sweating.
very good, very good. And then radiation,
hypothalamus,
hypothalamus. I mean, in this radiation, how does the body try to lose heat? By removing clothing, by positioning. Did you remember radiation? By removing the clothing and by maintaining your position. By, like, the heat is radiating from the skin to the nearby objects. Okay, to the nearby object, either touching a cold icy water bottle from your freezer, it comes under radiation. What about conduction? Conduction, the heat will be transferred to the environmental objects like air, water. Okay, remember this point. If your bodies they try to compensate, they try to lose heat by air and water, it is known as the conduction. And what about convection? Convection, transfer of heat by circulating air or liquid. In this, you are going to use some fan or hypothalamic blanket. Okay, convection. And then behavioral control, you are going to have a cold shower, you are going to decrease when you work too much, when you exercise you sweat a lot. So but when you are at rest, you do not sweat, you feel cold and calm. So this is your behavioral control, you are trying to control your body temperature. So next, what are the factors that affect body temperature? Okay, so as example, a baby with 10 years old, no, not a baby, a child with a 10 years old and a man with 50 years old, the temperature will be different. Okay, so age temperature regulation is unstable until general reach puberty. Normal temperature gradually drops as an individual approach adulthood and all age. So as we become adulthood, our temperature drops down. Okay, exercise, any form of exercise increase heat production. Do you agree at this point? Exercise increase your heat production. This is what you have
Yes,
been
ma'am.
doing. When you exercise,
Yes, ma'am.
when you don't exercise, when you work for 10 minutes or bricks work, you are increasing your body temperature. This raise your body temperature. Any kind of exercise, even walking, cycling, anything, they will increase your body temperature. After prolonged exercise, body can be high and it can ranges from 39 to 41 degrees centigrade. Okay, and then third is hormonal level. First one is age, second exercise, third is hormonal level. Women gradually experience greater fluctuation in body temperature than men. Why women tends to have more body heat than women? Because of greater amount of progesterone. Okay, because of greater amount of progesterone hormone. And then coming to the next is circadian rhythm. What is circadian rhythm, by the way? This is very important to know. Okay, what is circadian rhythm? Circadian rhythm is you used to sleep at night, all of you, right? We are not day sleeper. We used to sleep at night. We used to do our activities at daylight. So this is the normal. So this is known as a circadian rhythm. The hours that we sleep during the night, the rhythm that we are following is known as the circadian rhythm. Okay, so body temperature normally changes 0.5 to 1 degree centigrade during 24 hours. Temperature usually lowers between 1 to 4 a.m. Even though the weather is too hot and too warm, you always feel a little colder when it comes to the morning time. Am I right? Like 1 to 4 a.m. and 2 to 5 a.m. What do you say? Am I right or wrong?
Yes, ma'am.
Even though it is
Yes,
morning,
ma'am.
Yes, ma'am.
it tends to feel a little colder. Why? Because at this time, between 1 to 4 p.m., the temperature gradually goes down by 1 degree centigrade. This is known as the circadian rhythm. So circadian rhythm, it affects your body temperature regulation. Okay. The next point is stress. So stress, what is stress? 10 minutes. Okay, I only have 10 more minutes to end this meeting. Let's fasten up. Okay, so stress, any physical or any psychological stress cause increased body in your temperature as certain hormonal and neuronal stimulation. Suppose when your teachers give you some example, or when your teachers say come fast, or else if your ma'am desire calls you from hostel, you won't come in a very slow mo. Am I right? You will come in a you will come, I mean, you will try to reach as soon as possible, or else if some so this increases your body temperature. This is a physical or psychological stress. Suppose if I say write an assignment and you submit me within 10 minutes, you will stress yourself. You are trying to make this assignment to get done before 10 minutes. So this stress, it will increase your body temperature. And even one example, when even your exam time, when you touch your forehead, you used to feel very warm. Am I right? This is because of the stress, because there is hormonal and neural stimulation. That is why your body temperature is rising. Understandable? Okay, the next point is environment. Environment causes changes in body temperature. This is right. Okay, when you live in a cold weather, you feel cold. When you live in a warm weather, you feel a little warm. Okay, so environment it affect the temperature regulation. Okay, the next is assessment of body temperature. So how do we assess body temperature? How do we check body temperature? Do we have any other device to check body temperature rather than thermometer? No, we don't have any other device rather than thermometers. So there are 4 types of thermometers available. Okay, I think everybody is aware of this. Mercury, which is available in glass thermometer. Electronic thermometer is the one that you are using right now. Everyone have this electronic thermometer with you, right? And then mercury, I think it comes in glass. I think you must have, everybody have seen this mercury thermometer. Am I right? They used to have a mercury which runs ups and downs. Okay, and the disposable thermometers, and the 4th one is the tympanic membrane thermometers. So there are 4 types of thermometers: mercury thermometers, electronic, disposables, and tympanic membrane thermometers. So this is the electronic, the mercury thermometers. The second one is the digital, your electronic, and the 3rd one is a disposable, and the 4th one is the tympanic membrane thermometer. Okay, everything is clear, right?
Yes, ma'am.
Okay.
Yes,
So now you tell me, what are the sites of body temperature? Where are the areas that you can take your body temperature? Quick.
Ma'am, mouth, axilla, rectum,
Yes, mouth,
axilla, rectum,
rectum, and even your forehead, right? When you
vagina,
axilla,
your hand with your forehead, axilla. Okay. Okay, rectal, oral, axillary, tympanic. Okay, tympanic also, you forgot tympanic, the one which comes in your ear. Did you remember the previous picture? Tympanic thermometer. So the sites are, come again, rectal, we used to take from the rectum area, oral from the mouth, axillary from the armpit, tympanic, which is from the ear. Okay, so these are the sites of taking body temperature. So advantages and disadvantages, I think all of you know, right? So when you put this mercury thermometer in your mouth, what is the disadvantages? The patient may chew and swallow. When the patient is irresistible, when the patient is restless, there is high chance of chewing this mercury thermometer. So once your mercury is being chewed, the patient, this is a dangerous situation, right? And then when you these are some of the disadvantages. Okay, and then any other disadvantages? So now when you, after this class, you have to check the sites of body temperature, And then you have to see for the advantages and disadvantages. If you take through the oral, what is the advantages, what is the disadvantages? So if you take oral, then there is high chance of chewing, and by what is the disadvantages, it is not so much accurate. Suppose if you take by rectum, it is like purely accurate. So what is the disadvantages? High chance of this of infection and all. Okay, so this is the thing. So now this is the assignment. Okay, when you after this class, you have to go through key what are the sides of taking body temperatures, what are the advantages and disadvantages. Am I clear?
Yes, ma'am.
Yes,
Okay,
ma'am.
now come to the pulse.
Yes, ma'am.
So what is a normal pulse? What are normal pulse?
Ma'am, 60 to 100 per
Ma'am, 70 to 100.
You have to add some. You cannot say 60 to 100. You should say beats per minute. You're counting the beats, right, per minute. So you should say 70 to 80 beats per minute or 60 to 100 beats per minute. Okay, 60 to 100. So pulse is the palpable bounding of the blood noted at the various point where the arteries is near the surface and passes over a bond. When the blood is pumped into the arteries by the contraction of the ventricle. When your heart contracts, your blood is being passed on from aorta to your arteries. So at this time, how is the pulse noted? It is being noted when the arteries near your bone passes. When an artery passes over a bone, this is how you noted the palpable pulse. Okay, so what are the characteristics of a pulse? So pulse may have a characteristic of red. So when you take pulse, you should see for red, rhythm, volume, tension, and quality. So these are the 5 characteristics that you should check when you go for pulse assessment. Okay, red, rhythm, volume. Red is how much it is beating per minute. Rhythm, and then how regular is it irregular or is it regular? Volume, and then how much volume, tension, the quality. Okay, so red, the number of red, it is the number of pulse beats in a minute. It ranges from 60 to 100 beats per minute. Okay, so what do you mean by tachycardia? Tachycardia is a new terminology. Okay, for all of you, it is a new terminology. Note it down. Pulse rate above 100 beats per minute. When you go and check pulse, when you find the client, when you find your patient have this 100 beats per minute, more than 100 beats per minute of pulse rate, then you will say, ma'am, the patient is having tachycardia. Okay, and then what do you mean by bradycardia? Brady means lower. When your pulse rate is lower than 60 beats per minute, then it is called as a bradycardia. Okay, remember this two terminology. It might comes in your exam also. So now, so this is how everybody knows how to check pulse, right? So you are pressing on the arteries which passes over a bone, and then you are noting the number of beats per minute. And then what do you mean by rhythm? Red is like how many beats per minute. Now let's see what is rhythm. Okay, it is the pulsation and the push between them. It is the pulsation, how it is the pulsation and the push between them. Between 2 beats, we are seeing between 2 beats. Is it regular or is it like uniform? Is it irregular or is it fast or is it slow? This is how we should look at rhythm. Okay, it is the pulsation that we are taking in between 2 pulses. The rhythm may be regular, it may be irregular, or it may irregular rhythm is also known as a dysarrhythmia. This is also again a new terminology. Okay, dysarrhythmia. And then coming to the volume, volume, it refers to the fullness of the artery. It refers to the fullness of the artery, which reflect the strength of the left ventricular contraction. In normal condition, the volume of each pulse is strong at all areas where the arteries can be palpated. When you see in a volume, you will see for a bounding pulse, thread pulse, or weak pulse. Most of the time, the volume is very good, full strength when your left ventricle contracts. But when you can also, when you check your pulse, you can feel like one pulse is very strong, but the other one is very weak. So you term it as thready pulse. When the pulse is pounding very loud, then very slow, then you call it as weak pulse or thready pulse. Okay, and then when it pounds too fast, then you call it as pounding pulse. I'll end this meeting and you can join me in the same link again. Okay.
Okay, ma'am.
Okay, ma'am.